Hi, Dr. Second Chance here. I'm a licensed physician, a recovery coach, and someone in 13 years of long-term recovery. Um, I'm going to start a new series where I pick out some scientific articles with respect to addiction and treatment of addiction and briefly summarize them. You may find them interesting. This one has to do with a study on the use of ketamine as a treatment for severe alcohol use disorder. The study was published in the American Journal of Psychiatry recently. They took 100 people who had severe alcohol use disorder, and they divided them up into 4 groups. One group had 3 times a week IV ketamine, as well as 1.5 hours a week of psychotherapy with a therapist. One group had 3 times a week of ketamine with an hour and a half of just alcohol education. And then the other 2 groups had 3 times a week with just salt water, and then either the psychotherapy or the adult education. So there were 4 groups. And they looked at the people over 6 months, how many relapsed, and the number of days where nobody drank anything, where there was total abstinence. And the interesting findings were that, first of all, with the ketamine groups put together compared to the non-ketamine groups, there was a 10% reduction in or 10% more days of abstinence. So the group did better with respect to no days of drinking compared to the IV saline group combined. But then if you looked at the ketamine with psychotherapy group and you compared it to the saline group that had just alcohol education, that group had 15% more days of abstinence. So it appears that the ketamine really does help people with alcohol use disorder drink less and cope with it better. There's other studies on this too, and I'll do that in another video. And so that'll be something to watch. Does ketamine, which is also a dissociative anesthetic used in higher doses, can it really make a big difference? Unfortunately, in the study, the rate of relapse of all the people was the same. That didn't change with the ketamine treatment, but there were more days of sobriety, which could have long-term impact still on how many health issues a patient ends up getting. And so, the other thing about ketamine that's interesting, it's used for treatment-resistant depression. And so, and we know that that depression and alcohol use disorder commonly occur together. So, oh, excuse me, bless you. So it'll be interesting to see what happens in the long run with this. And continue to watch my channel, subscribe, share, hit the notification bell icon. Help me out, help it be successful. I will put more details of the study in the description below if you want to look it up to examine it yourself. Thank you, and we'll see you next time.